Hello guys, good evening. Welcome to the Ophthalmology INICT Recall. I hope you are doing well and relaxed after INICT examination. What are your reviews and what is your experience? We will talk about it. We will discuss about the ophthalmology questions. We will talk about the exam as a whole, and we will also talk about what next, because this is a point where you are just halfway through and still we are waiting for a bigger exam. And that's why I had said that whether it was a happiest moment, a happy moment, or just a good moment, it's very important to move on after this exam, taking care of your mistakes. That is the biggest part. So let me know if my audio video is okay. And one thing more, see, there was the paper in 2 slots, and you people were traveling, but whatever, we were interacted and I got to know about the questions. I have collected them, I have worked very hard, seeking the images, seeking the options, but still, because it is memory based and we can have the modifications. Please let me know in the chat section if there is any twist of the language, any change of the language required, any of the options required changes, or any image, so that we can do the corrections as well. Right? So let us start with the first question. This was, I think, the first question. The topical atropine is contraindicated in. So let me know the 4 options. Were these the right options, guys? So where does the topical atropine is contraindicated? The options, what I got to know, is a malignant glaucoma, the corneal ulcers, acute congestive glaucoma, and the acute anterior uveitis. So what do you say? What do you say about the malignant glaucoma, guys? So as you know, malignant glaucoma we had talked so many times, because it takes place due to the misdirection of the ciliary processes, and we have to break the cilio-lenticular block. That is why the mydriatics and cycloplegics, right? The mydriatics and cycloplegics are actually the drug of choice there. So when mydriatics and cycloplegics are the drug of choice in cases of the ciliary block glaucoma, the malignant glaucoma is also called as ciliary block glaucoma, or if the third name is inverse glaucoma. It is also called as the inverse glaucoma. When we call it as malignant glaucoma, ciliary block glaucoma, or it is also called as the inverse glaucoma, atropine will be the drug of choice here, right? Then second is your corneal ulcers. In the corneal ulcers, this is used as the adjuvant therapy, because you know that the corneal ulcers, especially when they are bacterial ulcers, we have always associated acute anterior uveitis, and the acute anterior uveitis, again, it is the drug of choice. This is itself a acute anterior uveitis. It is also the drug of choice here. That is why the answer to this question will be the acute congestive glaucoma. The answer to this question is the acute congestive glaucoma. And as you know that when we have the acute congestive glaucoma, it is the mid dilatation of the pupil that will precipitate the attack. It is the mid dilatation of the pupil that will precipitate the attack of acute congestive glaucoma, and that is why obviously atropine, which is a mydriatic and cycloplegic, will be the drug of a drug which is contraindicated. It will precipitate the attack of acute congestive glaucoma. So I hope you have got the answer, and meanwhile I also want to know what are your comments. Then what should be the drug of choice? What should be the drug of choice for the acute congestive glaucoma? What should be the first drug to be used and the second drug to be used? Because you know, acute congestive glaucoma is a acute ophthalmic emergency when we have the acute red eye. So what should be used actually as the drug of choice, as the first drug to be used? I think there is some problem in the network. I am not getting the... Yeah, now I am getting the options. Yes. Hi Akansha, Ankit, Nisar. So exactly, it is the acute congestive glaucoma. And what about this? What should be the drug of choice? What should be the first drug to be used and the second drug to be used? So the drug of choice here is the pilocarpine. Though pilocarpine is the drug of choice, but these are not the first drug to be used or the second drug to be used. First drug to be used will be the IV acetazolamide. Always remember, it is not the mannitol, rather it is the IV acetazolamide which is the drug of choice, and the second will be the IV mannitol. Second will be the IV mannitol. So this is the first question. And I think a very direct question from the notes. So I will not say about the strike rate. I think you people are the better judge. And I am happy this time because you know, AIIMS people are known for giving the hardest and the most volatile of ophthalmology. But as we tried hard, and none of the questions was just like a googly or a thing which could not be solved from the questions. So I think it was very well done. The second thing that we got, and I think this is the question that we keep on doing in the classes, on the live platforms, in the videos also. What is the angle subtended by the letter 6 by 6 from 6 meters? And one thing which I always say, that each letter of the Snellen's chart, if you remember the line also, always we discuss the Snellen's chart, then I always tell you that each letter of the Snellen's chart will make an angle of subtends the angle of 5 minutes only. It will make an angle of 5 minutes only at the respective distance. At a respective distance. So each letter of the Snellen's chart makes 5 minutes. That is minimum angle of resolution, but at the respective distance. Now what is the respective distance for 6 by 6? So respective distance here will be 6. Therefore the answer will be 5 minutes only. Now when we discuss it for the topmost letter, when we discuss about topmost letter, so there what would happen if I say topmost letter 6 by 60, then in that case the respective distance is 60. In that case you are going to get this 5 minutes at the 60 meter, right? But when I talk about 6 by 36, then the respective distance is 36. Then we will get this 5 minutes at the 36 meters. So this keeps on changing. This is the concept of minimum angle of resolution. Exactly. Acha, tell me about the other options also. Were these the other options? 5 minutes, 20 minutes, 50 minutes and 30 minutes. So you please tell me about the options also. Were these options there? Is this the correct language of the question and the options are correct or not? Please let me know. Please let me know if this is the correct one. Okay. Now next one. The most common cause of blindness according to 2015 and 2016 survey. Now there is some controversy whether this question came for blindness or this came for the low vision. So can you tell me, is this for blindness or low vision that was asked? Because in the classes we have discussed both, and I have told you, yeah, Ankit, yes, if it is blindness, obviously the most common cause of the blindness is the cataract. But my point is that certain students said that it was the low vision that was asked. So was it blindness that was asked or was it the low vision that was asked? Blindness ka obviously it's a cataract, and if it was the low vision that was asked, then it would have been the refractive errors. The options are 50 minutes is not there in the options. All right, so let me correct here. 50 is not there and 20 is there. 10 and 15, 5, 10, 15 and 20, something like this is there. Okay, moderate to severe. Ma'am, question was moderate to severe vision impairment. All right. So the language was not blindness, it was moderate to severe. Moderate to severe vision impairment. Okay. And the survey was 15 to 19. Okay. Oh, thank you so much, Aniket. So this was there. So when it is moderate to severe vision impairment, I think they are going towards the blindness, because the refractive errors will not lead to severe vision impairment. Then you can go with the cataract. All right, then please see the other things also. The most common cause of the blindness in children is vitamin A deficiency, and the most common infection which is causing blindness, I have told you this in many times, that is trachoma, right? These are all the parts of the Vision 2020 program also. They are the parts of the Vision 2020 program. And what is the other part here is the onchocerciasis. These are the things which are covered in Vision 2020 program. And because this is not found in India, so instead of this we take diabetic retinopathy, and then it is the retinopathy of the prematurity. Okay. In past it is given the uncorrected visual impairment. About what? Untreated cataract. I think if they are going towards the severe vision impairment, then cataract is a better option in comparison to the refractive errors. Options were untreated cataract, refractive errors. What were the other options? It is the untreated cataract. Now I think that is common sense. Obviously treated cataract will not be a cause of the blindness. So, and then the refractive errors were there. Okay. And what about the other two options? Was glaucoma and diabetic retinopathy were also there? Other two options are correct or not? Please check the other two options also. So this is again direct, I think, from the class notes, and I think this is a bonanza. So the two important features that we always discuss for the complicated cataract, one is the polychromatic luster and the breadcrumb appearance. Uncorrected cataract is there, diabetic retinopathy, yes. So diabetic retinopathy is there, we have written, है ना, diabetic retinopathy is there, and I think one more was glaucoma. ग्लोकोमा भी था. बाकी ऑप्शंस ठीक है. प्लीज कीप ऑन चेकिंग. सो व्हाट इज नॉट ट्रू इन कॉम्प्लिकेटेड कैटरैक्ट? दिस इज अगेन अ वेरी common topic that we have discussed in classes well in the other acquired cataract occurring from chronic anterior uveitis. Do you remember the list 1 and 2 also? It is the chronic anterior uveitis that is there, then high myopia that is also there. We have retinitis pigmentosa, long-standing retinal detachment, intraocular tumors, and the two important features are polychromatic luster and the breadcrumb appearance. So obviously the answer to this question is the Krukenberg spindles. And if you remember, I told you in classes that Krukenberg spindles will be asked this time, because there was a question in pseudo exfoliative glaucoma in 2022, and somehow I wrote 2023 on Krukenberg spindles, and luckily it has come. Krukenberg spindles are found in the pigmentary glaucoma, right? We have the two important features in the pigmentary glaucoma. Krukenberg spindles are there, and we also have the Sempeau-Lazy's line. And we have the Sempeau-Lazy's line. So Krukenbach spindle is a feature of not a feature of complicated cataract. It is a feature of pigmentary glaucoma. Can you tell me the fancy name of this cataract? What is the fancy name of the complicated cataract? Exact same line is given. Moderate to severe visual impairment. Commonest causes uncorrected vision impairment. Uncorrected vision impairment. Okay, Parks में exactly the same line has been given. Alright. So I think this question is clear. Then please see, I did not get the whole language of this question, but whatever language I got, that was sufficient to give the answer. This patient came with the foreign body, and there was a complaint of pain, photophobia was there, itching was there. We are also having the history of trauma with the fishtail. What is the diagnosis? What is the diagnosis? So whenever we have history of trauma with the vegetative matter, what do you get? Whenever we have history of trauma with the vegetative matter, that means we are having the fungal ulcers. History of trauma with the vegetative matter, can be the animal tail, or it can be any plant material. Anything can be there. So they have directly given you the history of trauma with the animal tail here. So it's a fungal ulcer, and anyhow, even if you could not make the diagnosis that whether it's a bacterial ulcer or whether it's a fungal ulcer, then also you know that this is actually hypopyon. Hypopyon means we have the pus in the anterior chamber. So this is pus actually. You can see this is the pus in the anterior chamber. So then also answer is hypopyon. Hyphema is the blood in anterior chamber. So you can see this is not blood in anterior chamber, rather it is the pus in anterior chamber. Then you should also know what are the important features of the hypopyon in the fungal ulcer. It is always non-sterile. It is always non-sterile and non-mobile. Always non-sterile and non-mobile. Why? Because they have got the hyphae, and because of this hyphae we have the penetration into the exudate. So it is always non-sterile and always non-mobile, as opposite of the bacterial ulcers. In the bacterial ulcers it is always sterile and always mobile, right? Then coming to the next question, which of the following drugs will increase the trabecular outflow, right? So any comments on this? What will be the answer here? And another important topic, as I told you in the classes, anti-glaucoma drugs, right? So this is again coming from the important topics. Anti-glaucoma drugs was given as the important topic here. So what is the mechanism of action of timolol? You know, this is causing the decreased aqueous formation. Acetazolamide is also causing decreased aqueous formation, right? Then we have the brimonidine, and then we also have the nitarsudil. So which of the following will be the answer? Yes, brimonidine is causing the two mechanisms. It is actually decreasing the aqueous formation because it's a alpha adrenergic analog, and it is also increasing the trabecular outflow. And nitarsudil has got all the three actions: decrease aqueous formation, increase aqueous outflow, as well as the decrease episcleral venous pressure. So I don't think that these options are good enough, because you know we have got both the drugs which can increase the trabecular outflow. Brimonidine is also causing the double mechanism of action, and nitarsudil is a rho kinase inhibitor that is also decreasing the aqueous formation, increasing the outflow, and also increasing this episcleral venous pressure. But if you have to choose one, I think nitarsudil will be the best option. It's a new group of drug, and we can go with this. Yes, the Rho kinase inhibitor. Okay. Then coming to the next one, the match the following. Match the following mein I have not got one option. There was Goldman's applanation tonometer, there was a perimeter, then Ishihara's chart was there. Can you tell me? Yeah, but actually क्या है कि brimonidine causes increased uvoscleral outflow, but that is also controversial because in certain books and certain pharma faculties also, in my videos I have taught this only, that we have got actually bus something like this, that brimonidine increases the uveoscleral. But certain, pharma faculties and certain pharma books says that all the alpha adrenergic analogs increases the trabecular outflow only. So there is a controversy. That is why I said that nitarsudil is the best option, because that is definitely increasing the trabecular outflow. Most common नहीं था मैम. कहाँ पर most common नहीं था? All right, now see this. Can you tell me what was one more option here? हाँ, वही मैं बोल रही हूँ, क्योंकि ब्रिमोनिडीन में कंट्रोवर्सी है. Some book says that increasing the uveoscleral outflow है. Some book says it is trabecular outflow. So I think it should not be brimonidine. So I want more input on this, whether it was brimonidine or not, because I think they should not give brimonidine as the option. And if it was prostaglandin analogs, then there is no controversy. And again you will go with the nitarsudil. So anyhow, answer will be nitarsudil only. Please, other people also give me input if brimonidine was there in the options or not. Okay. Okay, tonometer was there. So tonometer is this one, Goldman's applanation tonometer. Transverse sheet like, something started with the transverse. Was it transverse slit? Transverse slit was there, guys. Please check if this was the right answer. So, Ishihara color plates, they are for the color vision. Perimeter is for the peripheral vision. Goldman's applanation tonometer is for IOP, and I think transverse slit will be for the central vision. Please check if it is the right option, guys, and let me know. Please let me know if it is the right option. So I think it's very, very simple. We have discussed it so many times. This is the Goldman's applanation tonometer, and we know it's a type of tonometer. This is a gold standard. You know the principle also, and what is the difference between the Schiot's indentation tonometer and the Goldman's applanation tonometer, that we know. Then Ishihara color plates, we know it is for the color vision. Then we have also discussed in classes about the perimeters, right? So we have Goldman's perimeter, and we have got the Humphreys field analyzer, Lister's arc perimeter. So perimeter is for the peripheral vision. So I hope there is no confusion. I matched only this and Ishihara charts. You did not match the other ones. I think they are simple ones. Hey Anirudh? Okay, never mind. So see the others. What is the most common cause of conjunctivitis in COVID-19? So this question came last year also, and when you stop expecting the questions on COVID, they start asking you. But anyhow, we always know that the viral conjunctivitis, most commonly the viral conjunctivitis is follicular type of conjunctivitis, and I told you whenever we have follicles, which layer will show follicles? It will be the adenoid layer. Adenoid layer will always show the follicles, and the most common type of conjunctivitis in COVID-19. Yes, so it is the follicular conjunctivitis. So this is a simple one, right? Now, was this the image? I think this image came. So you can see the two eyelids. When the two eyelids are getting adhesions, then it is called as the ankyloblephron. So this was the image for the ankyloblephron. While symblephron it is the two conjunctiva, that is we have the palpebral conjunctiva and then we have the bulbar conjunctiva. Palpebral and the bulbar conjunctiva, when they get adhesion, when both of these get adhesion, then it is the symblephron. And we have discussed this, that symblephron is found in cases of the same image was there, Surbhi? Okay, so whenever we have got the true membranous, whenever we have true membranous kind of the conjunctivitis, whenever we have the true membranous conjunctivitis, that can lead to the symblephron. Right, so this is there. Then we have the entropion. Entropion is the inward turning. But these the other options, inward turning of the lid margins. Inward turning of the lid margins is there in the entropion, and trichiasis. This is the rubbing of eyelashes. We have the rubbing of the eyelashes over the cornea. When we have rubbing of eyelashes over the cornea, then this is called as the trichiasis, and even if one eyelash rubs the cornea, then it is sufficient enough to say as a case of trichiasis, right? Ma'am, second question, 5 minutes is not in the options. I think 5 minutes definitely should be in the option because that is the answer. So if they are not giving 5 minutes, how can it be there? But still, what were the other options here, guys, in cases of this? Are these the right options? I do not know about the options. Image is right. 5 minutes was there. Navneet, थोड़ा शायद confusion है. I think 5 minutes would have been there. I think you have missed it. Sixth question, tangent screen. Sixth question. Shiva, I could not get you. Where did you get the tangent screen, beta? You have to tell me again. Then there was a question on optic neuritis and I could not get all the options. Please let me know about the other options. But luckily I got the option. I think that is the correct one because they said true about optic neuritis and RAPD is there. And I think we have discussed this ample number of times that it is the earliest manifestation. Right option for ankyloblephron. But what were the other options? I want to know that. It is the earliest manifestation of the optic nerve disease. Relative afferent pupillary, relative afferent pupillary defect. So whenever we have the optic neuritis or we have any optic nerve disease, the first sign that we get is the RAPD. अच्छा, ट्रांसवर्स स्लिट नहीं था, इट वॉज टेंजेंट स्क्रीन, देन दे विल नॉट बी मेश्ड गाइज. अगर टेंजेंट स्क्रीन था यहाँ पर, ओके, नाउ आई कुड गेट यू. दिस वॉज, आर यू श्योर? because somebody else also told me transverse slit. This was the tangent screen. Jerem's tangent screen. Okay. So can you tell me, guys, what were the other options true about optic neuritis? Oral steroids is first choice, was one of the options. Were they saying that oral steroids are given as a treatment? Oral steroids is the first choice of treatment. Okay, oral steroids are drug of choice. So obviously this is wrong. It is the IV steroids that is there. Multiple myeloma is not the cause. It is the multiple sclerosis that is the cause. And tell me the other option, CRCT, the investigation of choice, I think they have given, and it should be MRI. Is this the right question now? Have we completed the good options? So please see and let me know if these are the right options, and see a lot of questions again from the class notes, the keratoconus, and I think okay, associated with pain. Bionetting and cupping was there in optic neuritis. I think it was a separate question in the optic disc changes. What do you say, guys? Keratoconus wala check karo. Was this okay? Not seen in keratoconus. The Munson sign, scissor reflex on retinoscopy, irregular astigmatism. So obviously the answer here is the Harb's stria. So this we have discussed so many times. This is found in cases of the blue baby boy. We know H for Harb and H for horizontal. This is found in cases of buphthal moss. So what we know, see the Harb stria. Harb stria is found in cases of the buphthal moss. Therefore, this is the answer. And what you get in cases of the keratoconus? In the keratoconus, we get the V for walked and V for vertical. V for walked and V for vertical, that is there. So then I told you Munson sign. Munson sign is also found in the keratoconus. See, that is there. Then we have talked about myopia and irregular astigmatism. Because of the increased axial length and an uneven surface, the refractive status will be myopia. We will have astigmatism, that is also there. We have scissoring reflex in astigmatism, that is also there. Munson sign is also there. And keratoconus mein we have vertical stria. These are called as the walked stria. The horizontal striations or the Harb stria are found in the buphthal moss. So I think answer is very clear. Tangent screen hai, tangent screen हमने कर दिया. And that is the optic disc changes. That is a separate question. Pain was the fourth option in optic neuritis. Okay. So this CRCT was not there. MRI and CRCT. This is not there. We have pain as the fourth option. Please everybody check. Is it the pain or anything else? And see, don't think that now I have done mistake, over is over. These questions and these topics, as I told you, are important for your NEET examination also. Questions are not repeated, but topics are always repeated, and these things and these lectures are always repeated. And plus, you know, AIMS questions can definitely repeat in NEET. So please work on these questions, whatever we have done, and that is why I am taking a lot of efforts that you know the right options and the right questions and the right answers to these questions, because definitely they are going to be repeated in NEET. Okay, pain is there. So keratoconus was done. Now see the another question, and again see pterygium I told you is a must question, and a very similar image also we have discussed in the class also. Please see if this is the right question. Incorrect about this lesion. So this is pterygium. Multiple sclerosis is the most common cause written. Dhruv, was it a multiple choice question? Because multiple sclerosis is indeed the most common cause of optic neuritis. So if they say MS is the most common cause and they say RAPD, so both the options will be right, because they are asking about true option, I think. Right, so RAPD is also true and multiple sclerosis is also true. That's why I fear if multiple sclerosis was there in the options. So I have definitely told you this in classes, that when we are doing the excision of the surgical excision of the pterygium, the risk of recurrence is very very high. 30 to 70% chances hai of the recurrence, and they are saying that simple excision can reduce the recurrence by 90 to 95%. So 100% false statement. Then yes, multiple myeloma, right? Yeah. So this consists of a head part, a body part and a tail part. So this will be the head part. This is the head part, and then this is the body part, and this is the tail part that is there. It can be progressive. So yes, it can be progressive if we have the hyperplastic changes more than the degenerative changes, while regressive type, if the degenerative changes are more than the hyperplastic changes, and the type of degeneration is the elastotic type of degeneration. So a very well studied question, and again from an important topic, pterygium. And in the NEET 2020 we had a question on the Bitot spots, and then also I told you that the degenerations are important, and that is why I always take the Bitot spots along with the degenerations, so that you know the difference, right? It was single correct ना, तो अगर single correct था तो I fear कि दोनों नहीं होंगे. I think multiple myeloma ही रहा होगा, right? Now see this. Again, I could not get one more option. Please see if you can recollect one more option not seen in glaucoma. I think they were talking about the primary open angle glaucoma and the optic disc changes. Primary open angle glaucoma and the optic disc changes. So obviously this we have read. There is an increased size of the cup. Cupping is also there. Then we have got the Roini's central nasal step, and Bioknitting sign is also there. Bioknitting sign क्या है? Bioknitting sign we are getting in the optic disc changes, where you are getting the nasal shifting of blood vessels. So we have the double bending of blood vessels or the Z bending of the blood vessels. That is the Bioknitting sign. Now, can you see here, we are getting optic disc changes in the form of CD ratio. We are also getting Bioknitting sign, but the Roini's central nasal step, this we are getting in cases of the visual field defects. So, in order to give the right answer, I need to know this fourth option also. Do you remember the fourth option? Because Roini's nasal central step is found, right? But this is actually in the visual field defects. So if B option is again coming from the optic disc changes, so I think then we will go with this change, Roini's central nasal step. Had they asked specifically from the optic disc changes, or they had asked changes from open angle glaucoma? Because these three are definitely coming from the changes of open angle glaucoma, but increased CD ratio and Bioknitting sign are from optic disc, while nasal step is from visual field defects. This is occurring due to the unequal contraction. Unequal contraction. This one is there. Unequal contraction of the arcs. So you can have a arcuate scotoma above and a arcuate scotoma below. We can have a larger arc on one side, smaller arc on the other, or it can be vice versa. We can have a smaller arc above and a larger arc below. So a step ladder pattern is formed. That is your Bioknitting sign. Specifically optic disc changes tha. So I think then the answer should be this nasal step, but I would appreciate if you can tell this option also. What was one more change? We have the cupping, we have got thinning of neuroretinal rim, We also have the asymmetrical cupping, that is also there. We have the asymmetrical cupping, and we have the vertically oval cupping. We have got the splinter hemorrhages, that is also there. Then we have the laminar dot sign, that is also there. We have bioknitting sign. Then we have the cavernous type of optic atrophy, cavernous optic atrophy. So out of all these, what was the other change that was found? It was specifically the optic disc changes. Very good. So what was the other third change from the optic disc they give? Please try to suggest. Then another important question which they asked, I think I could not get the full language, a pregnant lady with unilateral headache. Then they said pulsatile proptosis with diplopia, tinnitus, and they said fundus is normal. Which of the following structures are involved? Is this the question? Because again we have discussed this so many times. Pulsatile proptosis, PCB, I told you, na, physics, chemistry, biology. So then this is called as the bandy striate. Then this is called as the bandy striate, and bandy striate is found in the caratico-cavernous fistula. So this fistula is between the internal carotid artery and the cavernous sinus. So obviously internal carotid artery is also involved, cavernous sinus is also involved, and when these are involved, all the nerves are involved. We know that from the center, what are the structures passing through the center? You can see we have internal carotid artery and abducent nerve. So internal carotid artery is also there, abducent nerve is also there. Then we have got the oculomotor nerve, that is also there. One option may mention was cavernous sinus and internal carotid artery. This was a multiple choice question. Bearing of the blood vessels, nasal retinal vessels. I think it should be nasal shifting of blood vessels. What do you say? Was there यहाँ पर nasal shifting of blood vessels? Nasal shifting of the blood vessels, that is there. And this was a multiple type of choice type of a question. But when they say about the pulsatile proptosis, right, pulsatile proptosis means caratico-cavernous fistula. Caratico-cavernous fistula means definitely cavernous sinus and internal carotid artery. This sinus, cavernous sinus and internal carotid artery are involved, right? And when cavernous sinus is involved, then the sixth nerve will also be involved. Third nerve can also be involved. So if it is a multiple choice type of question, and if all the four options were there, then we can go with all the four options also. If there was an option containing all the four things, then we can go with them also. And if there was not an option, then we will go with cavernous sinus and internal carotid artery. You have to tell me the options. You know the structures. See, pulsatile proptosis definitely means caratico-cavernous fistula. So definitely cavernous sinus and internal carotid artery are involved. Now what are the structures passing through the center of cavernous sinus? We have again this internal carotid artery and the sixth nerve. So sixth nerve is also involved. And through the lateral wall, we have got the third nerve, fourth nerve and fifth nerve. So all the structures. ठीक है ना? So you have to see how many pairs were given. Then I could not get even this question as a whole, but some question was there on right hemi neglect. I do not know the exact language of the question, the options, but interesting laga. So definitely I would see that one side area is neglected by this patient. Something interesting they tried to create, the person is not making anything on this side. So one side he is neglecting. Can you tell me this question and the options? I'm really interested in this. If somebody can tell me the options and the question of. This question was based on hemianopias, and I think this patient says that I'm not able to see from one side, and then doctor gives him this picture to draw, and he is not making one side picture. I think something like this. It is the right parietal lobe and then we are having the right premotor cortex, then left parietal lobe was also there. Okay, the question was left-sided disuse of limbs and hemi-neglect, right and left posterior parietal damage, right and left posterior parietal damage. It was a hemispatial neglect. So this was not right. They said it was a left hemi neglect. So I think I need a more proper framing of this question to give the answer. So I would definitely say which part of the brain is involved. I would definitely say that please give me more of the inputs if this is correct. Because if there is a parietal lobe problem, then we have the superior fibers which are affected, right? So it is pi in the floor. So if I say the parietal lobe lesions, then it is not hemi, then it is the quadrant anopias. And in this question, we are having the hemi neglect, I think. So I am not sure about the options. Premotor cortex, right parietal lobe, left parietal lobe, and the posterior parietal damage. So please let me know if these are the right options and the question is correct. Meanwhile, we will have a look from question number 1, and please keep on correcting me if there is anything that has to be changed since this. So number 1 was a topical atropine is contraindicated in, and a quick recap. This atropine is contraindicated in the acute congestive glaucoma because you know that the mid dilatation of pupil can precipitate the attack of acute congested glaucoma, right? Left posterior parietal lobe damage, these two options are there. टेम्पोरोपेराइटल अगर होगा तो वो हो सकता है because temporal lobe and parietal lobe both will make the optic radiations and whole of that will make the hemi neglect. Direct question. अच्छा, I think that this is a better option. If you were getting this, then I can relate it with let me see if this was there. So obviously we have contralateral hemianopia. So if I am getting the right temporoparietal lobe, right temporoparietal lobe, then this would have been the answer because we always have contralateral homonymous. We will have the contralateral homonymous hemianopia. So because it is contralateral homonymous hemianopia, so obviously this will lead to the left hemi neglect. He was neglecting left side of the body while taking bath. Okay. Father neglecting the left side of the body, taking the bath. So the son gave this history that father was neglecting the left side of the body, taking the bath. And which part of the one question was on the oculocephalic reflex. Alright. Left temporoparietal and right temporoparietal. So if they are giving you left temporoparietal lobe and the question was the left hemi neglect, then the answer will be the right temporoparietal lobe. instead of the optic radiations. This was very simple. If this was a question, he was neglecting the left side, right? So that means the lesion is always on the contralateral side. So it's a right-sided defect. And if it was a right hemi neglect, then it was a left-sided defect. Now, where do you get a defect? So if it is hemi, and then you have to go at the level of optic tract, or you have to go lateral geniculate body, optic radiation, or visual cortex. Because if it is only the parietal lobe or only the temporal lobe, then we have to go with the quadrant tenopia. So I think this is the one. History including one question was on retinoblastoma. I could not get a question on retinoblastoma. This patient is more susceptible to what else condition? Yeah. So this again is a direct question. If this was asked, the most common primary tumor which is associated with the retinoblastoma, then this is the pinealoblastoma, and the most common secondary tumor which is associated is the osteosarcoma. This patient is more susceptible. Okay. Then one question was there on this retinoblastoma. Then you are saying the oculocephalic reflex. So what were the options they had given? You have to see that. Tell me the other questions also, and then I'll quickly show you this also. Yeah. So the second was the angle subtended by the letter 6/6 in the Snellen's chart, and that too from 6 meters. So you know that each letter of the Snellen's chart will make an angle of 5 minutes only, but from the respective distance. So here the answer is 5 minutes. And see if the options are correct. We have 5 minutes, 10 minutes, 15 minutes and 20 minutes. So this is the question number 2. Now, if the most common cause of blindness was asked, then the answer is the cataract. But you people are saying that it was actually moderate to severe vision impairment. Then we can go with the uncorrected refractive errors. So because somebody was saying that it is a direct language given in the parks. Okay, so this is 2015 to 2019 survey. The most common cause of the moderate to severe vision impairment, then the answer will be the uncorrected refractive errors, right? And then not true in the complicated cataract. So this again is a direct question. The Krukenberg spindles are found in the pigmentary glaucoma. Then there was a question on the fungal corneal ulcers. Some patient coming with the foreign body sensation, pain, photophobia, itching, and also history of trauma with the fishtail, and the diagnosis is. So they had also showed you a hypopion. So answer was hypopion here. Which of the following drugs is increasing the trabecular outflow? So this, I think this option brimonidine was wrong here. We were having the timolol, acetazolamide, prostaglandin analogs, and the nitarsudal. So answer was the nitarsudal, right? Then match the following में Goldman's applanation tonometry will be matched with the IOP, perimeter with the peripheral vision. I do not know about the C option. Some people are saying transverse slit. Some people are saying it's a tangent screen. And then number D is Ishihara charts. So that is for color vision, right? Then the most common cause of conjunctivitis in the COVID-19 is the follicular conjunctivitis. Then this was ankylobliphrone, you can see, and ankylo means the adhesion of the eyelids, while the adhesion of the conjunctiva will lead to the semblefron. I am not sure about these options. Antropion is the inward turning of the lid margins, and trichiasis means rubbing of eyelashes over the cornea. Then true about the optic neuritis. You have to tell me about this option. I'm not sure about again this option. RAPD is definitely there. Multiple myeloma is the common cause. That is false. It is a multiple sclerosis. That is the most common cause. Oral steroids are the drug of choice. Oral is again wrong. It is the IV steroids, and if associated with pain. So actually it is plus minus. Some cases of the optic neuritis like the retrobulbar neuritis can have pain also, right? Then keratoconus mein half stria are not seen. They are found in the buphthal moss. Incorrect about the pterygium. I think very first option was incorrect. Simple excision can reduce the recurrence by 90 to 95%. So that is wrong, because we have the rate of recurrence from 30 to 70% if we are having the simple excision, right? Then not seen in glaucoma. Optic disc changes. So if they are specifically asking about optic disc changes, then the answer is the Royne central step that is found in the visual field defects, the increased CD ratio, the bio-knitting sign, and nasal shifting of blood vessels. All these are found in the optic disc changes, right? Pregnant ladies coming with the headache, pulsatile kind of proptosis, diplopia, tinnitus, fundus is normal. So which structures are involved? Basically, then it is a fistula, and definitely cavernous sinus and internal carotid artery will be involved. Then we are having this question on the left hemineglect, because it is a left hemineglect, therefore it is a right temporoparietal lobe lesion. So I think these were the questions broadly. Then there was one more question on this retinoblastoma, most common primary tumor and most common secondary tumor. Primary means patient with the retinoblastoma, and secondary means patient treated. Patient treated for the retinoblastoma. Now the most common tumor that can occur is the osteosarcoma. In the 13 questions, sparing of nasal vessels was the option. Here, sparing of the nasal vessels. So that is also there, because there is a shifting of the temporal vessels towards the nasal side. So we can say we were having the sparing of nasal vessels, and because of the shifting of temporal vessels towards the nasal side, I am getting this bio-knitting sign. So I think Royne's nasal central step would have been the answer, because that is a visual field defect. So with this, we have come up to the end of discussion. I hope I have given you the right options. After the video, if you are not watching me live, please do let me know if any of the question needs any modifications, or any options needs any modification, any image. If you want to add up any other question, and definitely work on these questions and these topics, because they are going to be definitely repeated in the NEET. So thank you so much, guys. Happy ophthalmology.